Okay, Mr. Lin, thank you for allowing me to come to your house. And I create this pamphlet, and so you can take a look as I'm going to discuss this with you. Thank you. So what is BPH? BPH is benign prostate hyperplasia. It is a very common condition for male. And according to study or statistics, they are 51 to 61 years old. They were 50% of male will have BPH. By the years of 80, there were 90% of male population have BPH. And the prostate functions. The prostate location is in front of rectum, and the function of the prostate is to make the milk fluid to help nourish sperm. The prostate will grow because the male sex hormone will makes the prostate to grow in size. Between age 21 to 50, the prostate will double in size, and by the 60 years old, the prostate will grow lengthwise, which means that it will grow not just wide, but the length will exceeding the width. So that's why it is enlarged. We call it hyperplasia.
So what is the impact on me?
That's a good question. I have on the second page, I made a diagram for you. On the corner right here, the hyperplasia, it will compress the urethra, make urination difficulty. And the other second physical change, it will produce the bladder cell will become thickening. And because the thickening can cause the muscle to overstretch, and so it will lose the muscle tone. So that's why male has a problem of bladder retention.
So what are the symptoms of BPH?
Good question. The symptom I have shown in the second page, it has a hesitancy. Hesitancy means that it takes longer for the urination to start, and the strength will be weaker, and also it will cause the urination, sometimes incontinence. Incontinence means that you were doing something and suddenly you have no warning, the urine just come out, and sometimes it will cause a male embarrassment and very inconvenience for people. One of the symptoms for the BPH chronic urine tract infection. Urine tract infection because the bacteria like to grow in moist area, and so it's one of the common symptoms.
So how is BPH diagnosed?
Good question. The diagnosis will be required. The doctor will do the urine flow meter test. It's a funnel shape, and you will have to pee into the funnel with the electrical wire around it. The doctor will measure the strength and how fast your urine going. And the other one the doctor will do is do the PSA. The PSA is to check if you have cancer. The PSA prostate specific antigen, if it's too high, there will be indication of abnormal cell. And the doctor will also do the rectal digital exam when the PSA is elevated. And the most important thing, the doctor will also give you IPSS. It's a form cell questionnaire, and then by answering those questions, the doctor will determine if you had a moderate or severe retention problem or prostate problem.
So how is BPH treated?
Oh, good question. I have also list on the third pages. The third page shows the BPH. So it depends on the severity of the symptoms. The best treatment and for the moderate will be using the alpha blockers, which is to help relax the smooth muscle. And if you see a commercial, generally it's the Flomax. And Hydrant Cardura is very common to use in my hospital. And some doctors also had a 5-alpha reductase inhibitor that is to help shrink the prostate. And they are Proscar or Avodart. Study shows having these two combinations, it works better.
So besides the medication, are there lifestyle or anything that we can do that
Very
to
good
help
question.
the condition?
Mm-hmm. Yeah, that definitely has, like, you can take tomato. The tomato has a lycopene. Lycopene substance is very helpful for the male, and it will reduce the prostate cancer. So those are very good. The other thing that you can do is doing the yoga or meditation, because it will help you relieve the stress. And also the Keiko exercise can help you strengthen your muscle around the bladder. The other one is avoid drinking alcohol and avoid coffee. And also stop smoking. I know you don't smoke, so that you will not have this problem. Also reduce the body weight, what helps.
Thank you.
Thank you very much.
Do you want to talk about the surgery? If that is not working, the surgery needed is when the people who require, who the medication is not working. So the doctor will do the TURP or TUMP or TUIP. I have listed on it. So generally what they do is the doctor will insert a catheter into your area, local area, and they will use the heat or microwave to shake the prostate muscle off. And so it will help you opening up the urethra so you can go through faster. So that's are things that this is the things that you can consider.
Okay.
Okay.
Well,
Great information.
That's
Thank
good.
you.
Thank you for
Thank you
letting
very
me to
much.
come in. Thanks.
Thank you.